Certain things that you eat can be very harmful, if not fatal, to your dog.
This video featuring groundbreaking insights and information from two renowned experts in the field, Dr. Eric Berg and Professor Thomas Seyfried. In this program, we'll explore how a combination of turmeric and a carnivore diet can help combat cancer in dogs. We'll dive into the science behind these natural remedies and share practical tips on how you can incorporate them into your dog's life to promote health and longevity. You should always consult your local veterinary before incorporating a new diet to your dogs. Thank you for joining me on this journey. Let's ensure that no one else has to go through the heartache of losing a pet to cancer without the knowledge and tools to fight back. Elevated blood sugar and insulin levels are at the root of many common human illnesses, such as diabetes, obesity, heart disease, and even certain types of cancer. These conditions are largely driven by lifestyle and dietary choices that lead to chronic inflammation and metabolic dysfunction. Unfortunately, similar trends are being observed in our canine companions. Just like humans, dogs can suffer from a range of health issues related to high blood sugar and insulin resistance. Over time, these metabolic disturbances can contribute to obesity, diabetes, and even cancer in dogs. It's essential to recognize these parallels because the steps we take to improve our own health can often be applied to our pets as well. By adopting dietary strategies that focus on reducing sugar intake and managing insulin levels, we can significantly enhance the health and longevity of our dogs. Incorporating natural anti-inflammatory agents like turmeric and exploring dietary shifts such as a carnivore diet can be powerful tools in this fight. These approaches not only help in preventing cancer but also promote overall well-being, ensuring that our pets live healthier, happier lives. Dr. Berg, where do we find problems with dog foods?
The problem too is when you're training the dog and you're constantly giving them certain types of food, it's raising insulin because every time you eat, you trigger insulin regardless of what they consume. So lots of dogs nowadays are developing diabetes, inflammatory conditions, and arthritic conditions, not necessarily just because of the frequency of eating, is what they're eating. Most dog food is composed of 46% to 74% carbohydrate in the form of corn, wheat, and other grains, okay?
We know that carbohydrates play a significant role in regulating blood sugar and insulin levels in both humans and dogs. When carbohydrates are consumed, they are broken down into sugar in the bloodstream. This rise in blood glucose levels triggers the pancreas to release insulin, a hormone that helps cells absorb glucose for energy. Dogs that consume a high carbohydrate diet can experience similar metabolic disturbances as humans. Frequent spikes in blood sugar and insulin can lead to insulin resistance in dogs. This condition can contribute to obesity, diabetes, and even increase the risk of certain cancers. Maintaining a diet lower in carbohydrates and rich in proteins and healthy fats can help manage blood sugar levels and improve insulin sensitivity for both humans and dogs. This dietary approach can lead to better overall health, reducing the risk of chronic diseases and enhancing longevity for our furry friends. We will now explain the benefits to give turmeric to dogs and when not to give them. Benefits of turmeric for dogs. Turmeric, a golden yellow spice, has been used for centuries for its medicinal properties. Its active ingredient, curcumin, offers numerous health benefits for dogs. 1. Anti-inflammatory properties. Turmeric is a potent anti-inflammatory agent. It can help reduce inflammation associated with arthritis, allergies, and other inflammatory conditions in dogs. 2. Pain relief. Due to its anti-inflammatory effects, turmeric can also serve as a natural pain reliever, particularly beneficial for dogs with joint pain or injuries. 3. Antioxidant effects. Turmeric is rich in antioxidants, which help protect cells from damage caused by free radicals. This can contribute to overall health and help prevent chronic diseases. 4. Improved digestive health. Turmeric can aid digestion by stimulating bile production, which helps break down dietary fats. It can also help with gastrointestinal disorders and improve gut health. 5. Cancer prevention and treatment. Some studies suggest that turmeric may have anti-cancer properties, potentially helping to prevent or slow the growth of certain types of cancer in dogs. 6. Boosted immune system. The immune-boosting properties of turmeric can help strengthen a dog's immune system, making them more resistant to infections and illnesses. How much turmeric to give dogs? The appropriate dosage of turmeric depends on the size and weight of your dog. Small dogs up to 20 pounds, 9 kg, 1/8 to 1/4 teaspoon per day. Medium dogs, 20 to 50 pounds, 9 to 23 kg, 1/4 to 1/2 teaspoon per day. Large dogs, 50 to 100 pounds, 23 to 46 kg, 1/2 to 1 teaspoon per day. Giant dogs over 100 pounds, 46 kg, up to 2 teaspoons per day. It's best to start with a lower dose and gradually increase it to allow your dog's digestive system to adjust. Turmeric can be mixed into your dog's food. For better absorption, combine it with a healthy fat, like coconut oil or olive oil, and a pinch of black pepper. When not to give dogs turmeric. While turmeric is generally safe for dogs, there are some situations where it should be avoided or used with caution. 1. Pregnant or nursing dogs. Turmeric may stimulate the uterus or affect hormone levels, so it's best to avoid giving it to pregnant or nursing dogs unless advised by a veterinarian. 2. Dogs with gallbladder problems. Turmeric can stimulate bile production, which may exacerbate issues in dogs with gallstones or bile duct obstructions. 3. Dogs with bleeding disorders. Turmeric has blood-thinning properties, which can increase the risk of bleeding. It should be avoided in dogs with bleeding disorders or those on blood-thinning medications. 4. Before surgery. Due to its blood-thinning effects, stop giving turmeric at least 2 weeks before any scheduled surgery to reduce the risk of excessive bleeding. 5. Dogs with kidney stones. Turmeric is high in oxalates, which can contribute to the formation of kidney stones. Dogs prone to kidney stones should avoid turmeric. Always consult with a veterinarian before introducing turmeric or any new supplement to your dog's diet to ensure it's appropriate for their specific health needs. Dr. Berg, now we know how to use turmeric. Many of our viewers wonder what you give your dogs to eat.
So the question is, what should you feed your dog? I'm going to show you what I feed my dog. 0 grains, potatoes, tapioca, or plant proteins. A dog was not designed to consume that many grains.
Thank you, Dr. Berg, for sharing your knowledge with our viewers. We will now listen to Professor Thomas Seyfried and how to fight cancer from his experience. You will find his information very interesting and helpful. Please see the video to the end to not miss any valuable information.
And people say, how do you get cancer? Well, you can get cancer from any number of different things, all right? Carcinogens cause cancer. You can get cancer if you're exposed to carcinogens. You get radiation will cause cancer. Hypoxia, absence of oxygen can cause cancer. Systemic inflammation, we heard from one of the talks that, Axel was telling us about systemic inflammation and others. Rare inherited mutations. People say, oh, it must be a genetic because, you got BRCA1 and believe for how many. Angelina Jolie has her breasts and ovaries removed from the BRCA1. She's trying to reduce her risk. That's all secondary. It's secondary because those BRCA1 mutation does not cause cancer unless it damages the respiration. And there are people around that have BRCA1s who will never get cancer because the gene is not damaging the respiration. RAS oncogene damages respiration. Hepatitis C, papillomaviruses enter and damage respiration. The older you get. So this was referred to as the oncogenic paradox. All right? This was first pointed out by Albert St. Georgi, who said, hey, there's so many different ways to get cancer, but the common pathophysiological mechanism is not clear. Okay? Well, once you understand it's a mitochondrial metabolic disease, the mechanism becomes very clear. So now, if most cancer cells obtain energy through fermentation, what therapies might be effective in managing? Well, one of the things logically is simply take away fermentable fuels and replace the body with non-fermentable fuels. And one of the ways to do that is stop eating. Calorie restriction, ketogenic diets, these kinds of things. What they do is their diet restrictions, they differ from starvation, they maintain normal levels of minerals, they enhance mitochondrial biogenesis, and also they replace fermentable fuel. You can't ferment ketone bodies. You need good respiration for ketone bodies. So you're going to remove the glucose, lower it down, and raise the ketone bodies, which the normal cells are going to shift over to, and the tumor cells are going to be marginalized. You can't use the ketone bodies. And don't forget, we just heard from Michael about the basal metabolic rate. I do this in the mice. The mice, we give 40% calorie restriction, but that's like water-only fasting in humans, okay? People have to realize that because of the 7-fold difference in basal metabolic rate. So ketogenic diets, a lot of misinformation, misunderstanding. Basically, these are low-carb diets, high-fat diets, but it's the types of fats and proteins that play an important role. I don't have time to talk about that. But basically, you eat these diets in a restricted amount. Ketogenic diet, unfortunately, it was labeled with the word diet, all right? Whenever you put diet, everything becomes like mysterious and things. It's a medicine. Ketogenic diet is a medicine. It's called ketogenic metabolic therapy, and it should be respected as a medicine. If it's not used properly, it won't work, just like any medicine. Not to say that it will harm you, but if you do eat too much ketogenic diet, you can in fact get insulin sensitivity. So we worked in the epilepsy field for years, and we understand how some of these diets can be not as effective as they should be. But the whole strategy is not complicated, all right? If the tumor cell needs fermentable fuel, then you take the fermentable fuel away from the tumor cell, and you transition the body to a non-fermentable status. So you lower the blood sugar that the tumor cells need, and you elevate ketone bodies, which the tumor cells can't use, but the normal cells can. You just simply marginalize the tumor. Now, the tumor needs fuel. It can't live without energy. Where's this getting? It's fermenting. You're taking away a prime fuel. What's going to happen to those tumor cells? They're either going to die or they're going to slow down, and that's what happens. Now, the first person that did this work was Linda Nebling, in a human situation, I should say. She took two little children, hopeless cases, brutalized by the system. If you read her PhD dissertation, you'd be crushed about what they did to these little kids. They surgically mutilated them, gave them massive doses of chemo, radiation, all kinds of stuff, and they gave them up for hopeless. They said, these kids aren't going to live more than 2 or 3 months. She says, can I try a ketogenic diet? She was in nursing, getting her PhD in nursing. Yeah, they said, it's not going to do, they don't have long. So anyway, she rescued both of these kids. Their quality of life improved dramatically. They lived far longer than what was predicted. And it was based on the whole shift of the body's metabolism. And I said, wow, this is unbelievable. This was back in 1995. And I said to my students, I said, we should try some of that with our brain cancer in the mice. And we were building these animal models beautiful animal models of human brain cancers. And we have the CT2A, a neural stem cell tumor. Everybody's excited about neural stem cell cancers. So anyway, we just gave them 40%. Standard diet is a high-carb diet, and the same diet restricted by 40%, which is like a water-only therapeutic fast in humans. And these tumors once started to shrink big time, go down 60 to 85% reduction in size. And we say, geez, this is like, wow, I never saw anything like this before. I'm so powerful. What's going on? So then we analyzed using linear regression analysis, using glucose as the independent variable, and either ketones or tumor weight as the independent or the dependent variables, and glucose as the independent. Each square is an animal on a different diet, and you can see on the left here, as blood sugar goes down, ketones go up, and this is an evolutionarily conserved adaptation to food restriction. Bodies are not getting the carbs. We're going to start mobilizing fats, bring them to the liver, chop them up, make water-soluble ketone bodies, and these are going to go to the tissues. And on the right, the blood sugar goes down, the size of the tumor goes down. The higher the sugar, the faster the tumor grows. The lower the glucose, the slower the tumor grows, right? So the higher the sugar, the faster your tumor grows. The lower the sugar, the slower your tumor grows, right? So if you want your tumor to grow fast, get your blood sugar up as high as it can get, right? So you go to oncology clinics, and you see everybody eating ice cream and cake and candies, right? Don't they read the literature? This has been supported now in human gliomas, breast cancer, colon cancer. If you want your tumor to grow fast, get the sugar as high as it can go. Now, people say, well, this looks wonderful and great, but, we don't understand the mechanism. Bullshit, you understand. We publish so many papers, and so many other people publish papers on the mechanisms by which this works. It's anti-angiogenic, anti-inflammatory, pro-apoptotic. No cancer drug is known that can do this without toxicity, and this can do it. So we and others have shown many papers the molecular mechanisms by which this process works. So when you hear people say, well, it's not proven, they don't read the literature, nor do they contribute to it. So this woman has this dog with a big mass tumor on his nose, right? Menka. Now, she listens to our YouTube videos and reads our regular papers, right? That's a layperson. She doesn't have any training in medicine or anything. So this dog has this big tumor. She goes to the vet. Oh, yeah, we're going to have to cut it out, and then we're going to give radiation and chemo. About $10,000. Maybe the dog will live 7 more months, but it's going to be sick and blah, blah, the same stuff. She says no. So she goes to the butcher, and she gets the fresh chicken meat with the bones in it, cuts the calories by 40%, throws in some medium-chain triglyceride oil, some raw egg, the dog loses about 5% of its body weight, and you can see the tumor starts to shrink and disappear. And you know, Mink is still alive today, doing fine. This was back how fast the dog responded. And there's many dogs now that they're putting through these metabolic therapies that are doing really well. Of course, the veterinarians who are all over me about this, they don't think they should feed the raw meat to the dogs because of salmonella poisoning. Give me a break, you know. So, I mean, you ever see what dogs eat? It's like, you know, give me a break. You know, salmonella poisoning. You know, you're looking at this stuff and you're saying, gee, and then you did a YouTube video on this for the dog cancer thing. You got 5.3 million hits. Can you believe this? So the tough people are all out there writing all these giving me all kinds of grief. The hell with them. You know. This is Pablo Kelly. Same age as Brittany, about 28. He's diagnosed with glioblastoma in August 2014. He emails me and says, can you help me? I don't want surgery, I don't want radiation, I don't want chemo. So I give him the kit that I send to most of the cancer patients who contact me. And I said, hey, you might as well try it, Pablo, because I'm definitely not doing it. He's from Devon, England. He says, okay. So I give him the kit. I hadn't heard from him. I didn't, maybe a year and a half go by. All of a sudden, I get a letter from Pablo. I said, oh, geez, Pablo. Pablo, he's still alive. So he went on. He had this big YouTube video telling everybody how he was going to do keto and all this stuff. But anyway, he says his formerly inoperable tumor now has become operable. So he asked, I said, well, if you can shrink it down, get it out, Pablo. So he goes out and it was earlier this year, gets the tumor out. He has a few seizures, but his quality of life is pretty good. His wife just had a baby. He's still alive. He's doing well, right? He has a quality of life. He's alive. But basically, we use press therapies, which can include the ketogenic diet, restricted ketone supplementation, and stress management. You know, you can't believe that when you have cancer, people get stressed out. You have this impending doom. I'm going to die. What does that do? It raises your blood sugar. Cortisol goes up. You've got to have stress management. So we use exercise. We use music therapy. We use yoga therapy. Whatever works to lower the stress of the individual. We use the diet as a press. The diet is controlling the availability of sugar and raising ketones that the tumor cells can't use. Once we get the patient into therapeutic ketosis and lowered stress, we then apply pulses. And we use drugs like 2-deoxyglucose, insulin potentiation therapy. We then hit them with glutamine inhibitors like EGCG, the green tea extract, chloroquine, the anti-inflammatory. And we're working, and we would like to get Don, of course, and others. And then we put them in hyperbaric oxygen chambers. Hyperbaric oxygen will kill tumor cells just like radiation does without toxicity once you remove the glucose and glutamine, get the patient into therapeutic ketosis. So we can replace the entire standard of care with a logical therapeutic process that's non-toxic. And we gradually move the patient from the disease state to the so-called managed state, and eventually, hopefully, to a long-term management and possible resolution using press pulse metabolic therapy. Now, how does it work? Okay, so here's a paper that we just published on a patient with glioblastoma from Egypt. We can't do this in the United States. You can't do this in England. All right? You can't do it in a lot of places. So we had to go to Egypt, where they read our books, they read our stuff, and they said, okay, we're going to try this. They came to me and told me how they're doing this, and they said, can you help us write it all up? And you know, a lot of physicians can't write papers. I do this for a living, right? So I said, we'll get the data, we'll put it all together just like we do the mice, and we'll set up a protocol. So management of glioblastoma in patients with ketogenic metabolic therapy with modified standard of care. That's what we can't do so far in this country. IRBs will not allow us to modify the standards of care. So we took this guy, he came in, his whole left side, he's dragging. You know, he was a metabolic mess. He had pre-diabetes, he had low vitamin D, he had all kinds of other issues besides he had a glioblastoma. So the first thing Dr. Elsaka did, we gave him a 3-day water-only fast and then transitioned the guy to a 900 kilocalorie a day for 21 days with the ketogenic diet. So he's out over 3 weeks before we touched him. Then he did an awake craniotomy. We debulked the tumor. The tumor looks different now. The tumor has a different morphology based on the treatment of the diet up front. You're shrinking down those cells. Then for another 3 months, we gave him chloroquine, we gave him EGCG, we gave him hyperbaric oxygen. Then we were forced into doing standard of care because they have to do it. So, and while he's getting the standard of care, which is radiation and chemo, he's also on hyperbaric oxygen and the diet as well. And then for another 3 months, you can see after that. And now at 24 months, the guy is doing fine, right? Now he's a corn farmer. He's back out working in the fields. So now he's out 30 months and he's still doing. I just got talked to Osaka the other day. I said, how's the guy doing, the corn farmer? He's doing fine. So he had a little radiation edema, which pisses us all off, something fierce. You don't want to radiate the human brain under any conditions. You know, I don't understand that. It kills me. You know, I'm looking at these poor people and I'm saying, what are you doing? Well, we have to kill the tumor cells. Just take away the glucose and glutamine, you get the same effect. So conclusions, cancer is a type of mitochondrial metabolic, it's not a genetic disease, okay? This misunderstanding is the greatest tragedy in the history of medicine, leading to the unnecessary suffering and death of tens of millions of people by a fundamental misunderstanding of what the nature of the disease is. These cells rely on substrate-level phosphorylation. It's the hallmark of what these cells do. They're dependent on glucose and glutamine as the prime fuels for GBM and all these other cancers. They need that fermentable fuel. Who's targeting the fermentable fuels? Nobody. The press-pulse metabolic therapy is non-toxic, cost-effective for the management and possible resolution of all types of cancers. It's a singular disease. All these tumor cells are all fermenters. It doesn't make any difference. It's my opinion, and I could be, I don't know if I'll live to see it, that this strategy will eventually make all other strategies obsolete. It's just a matter of time.